It's 6:42 this Tuesday morning, and as you grow older, oftentimes you learn to love the skin you're in. The thing is, sometimes your skin, well, it doesn't love you back, and it starts to droop and dimple and wrinkle. And live from the SFL in Harbour this morning, Kristen Anderson is learning some plastic surgery 101. So Kristen, I gotta ask you now, have you found a fountain of youth? That's what you're searching for this morning, right?
I'm searching for that fountain, Eugene. Haven't found it yet. Or have I? Right now, I'm holding a little bottle of what some may think is the key to beauty. It's Botox. So, Surgical Studio 2, I'm going inside for you. You're all access pass, your consultation on the morning show, if you will. So Dr. Michael Salzauer has been so wonderful showing us the ropes of Plastic Surgery 101. We talked about the Brazilian butt lift, doctor, and now, I mean, how much have we heard about Botox? Samantha in Sex and the City 2, for example, I think she said it 500 times in just that movie alone.
Well, Botox is the most popular injection right now in America to help people look younger.
For women and men?
For women and men.
Oh, okay.
About 20% of my patients are men that come in for Botox.
Okay,
Yeah.
Okay, so basically, I mean, I know the fear when we hear Botox is that we're not going to have any smile lines and we're basically just going to be like this.
Well, there is an art to it. Botox does relax the muscles. It lasts about 3 or 4 months.
Okay.
And the way it works is by relaxing the muscles, you can't make all those faces that give you wrinkles. For example, you look at the screen here.
Okay.
Here's a patient. You see how she's got lines going across her forehead here.
Right.
Especially down here in Florida with the sun. You're squinting all the time, you're raising your eyebrows up, and so you get these lines. And over time, over years, those lines become permanent. So by relaxing the muscles, here's her afterwards. You see how she's got a nice smooth forehead, doesn't look completely frozen, and if you do it just right, you'll still be able to move them just enough to express surprise or shock.
Okay, I was going to ask you, like when she gets shocked, is she still going to look just like this?
No. If you leave the sides intact and so they have a little bit of motion, you look fine.
Okay, how bad does it hurt on your face and how bad does it hurt on your pocketbook, your wallet?
Well, on your wallet, it's about $300 per area.
Okay. And
there are generally 3 areas of the face that people like to treat. Those little number 11 lines between the eyes, the lines across the forehead here, we call those glabellar lines.
Okay.
Glabellar lines and forehead furrows. And then the crow's feet on the corners of the eye.
Okay, I know another one of your very brave employees here is she's not going to get stuck. She kept saying, don't stick me. But basically just go, what are some areas, some common areas where people get Botox?
Sure, you look at the beautiful Monica over here. Monica, do me a favor, raise your eyebrows up, okay? Well, actually, she's got a little bit on board right now, but you see how she can still move her eyebrows a little bit there and she can still frown just enough, but she's completely smooth there. The Botox would go in between the little number 11 lines between the eyes. It would go across the center of the forehead here. It takes about 3 or 4 days to kick in. It's not that painful. People describe it as something similar to a mosquito bite. Okay? So imagine getting 10 little mosquito bites from a magical mosquito that makes the wrinkles go away.
Okay, magical. And you're happy?
Extremely.
Extremely happy. Okay. Yes. All right, so the risks involved, are you just saying too much is not a good thing, everything in moderation?
Absolutely. Too much is not a good thing. If you overdo it, obviously it can be completely frozen, or you can even have some eye droopiness. The good news is that Botox only lasts 3 or 4 months, so if you don't like it, it goes away, and you're completely back to normal with no long-term, adverse effects.
Doctor, thank you so much. Everyone, we welcome your questions. If you have any questions, send them to feedback@southflorida.com, and I will ask the good doctor here. Live from the SFL, I'm Kristen Anderson, sending it back to you guys in the studio, and I'm still searching for that fountain of youth.
Don't give up. Keep looking.
She says it's here.
All right, thanks, Kristen. We'll check in with you later on. From one Kristen to the next, let's check in with Kristen Kane because, Chris, usually the skin